Hey everyone, this is my final PowerPoint for evidence-based practice. I chose to do my topic on prevention of ventilator-associated and hospital-associated pneumonia in the clinical setting, specifically the ICU. So here we go. So first off, introduction, why I chose this. Personally, it was due to my interest in the ICU and the problems that we can solve. This is a very important topic that affects basically every hospital, nation, and worldwide, so it's very important that we solve this. It is a very common morbidity, so once we can establish reliable methods of treatment here, we can hopefully move forward. Learning various methods of prevention is extremely important for a nurse and basically every medical professional, so planning around those interventions and incorporating them into our daily work will help to save lives and ensure patients leave the hospital feeling better about themselves. And then finally, it is important to just know these skills to become a better equipped nurse and just being able to work with your colleagues. So my PICOT question was, in telemetry/cardiac patients, and this is a subset of the ICU patients, how do modernized interventions by nursing staff compared to traditional/no interventions by nursing staff affect the incidence of pneumonia, both HAP/VAP, during the patient's clinical stay? The reasons for choosing this question were explained in the previous slide, but I liked the format of this question. I liked how it was set up, and I can compare one thing to the next, and it really helped me during the research process. So on to the lit review, my search process. I used the following websites: PubMed, CINAHL, and Web of Science to obtain my data. Listed below are some of the keywords I used: HAP, VAP, which we already talked about, ICU setting, comparison, interventions, and pneumonia. Boolean operators are just these handy little things that help to connect, isolate, and separate your keywords so you can eliminate certain factors. I remember using these for elimination of other infections that weren't related to pneumonia, and that really helped me. The two articles of interest that I found that I talked about in my essay were listed here. The first one was in favor of my traditional/no methods approach, and it was very helpful in kind of already taking established research and attributing that to the future, seeing what we can improve on that and really learn why this works for those patients. And then my sort of investigative article, one might say, was ventilator-associated pneumonia and suction, and that showed detailed, I believe, 4 methods, and they all talked about the varieties of suction that we can attribute to each ICU patient, how that can prevent pneumonia from occurring, and what we can do as nurses to sort of help those get off the ground and be used more in the practice. So both of these were very interesting, and yeah, very good articles in the end. So moving on into the nitty-gritty, just the processes of evidence-based practice. This is dissemination and implementation. So for dissemination, you really want to identify avenues to reach target audience. So this can be through a variety of things: conferences, meetings, seminars, anything else, groups, memos, and one thing that I did find out was having helpful signs, like they say outside of ICU or precaution rooms, that sort of tell the patient, tell the family member, tell whoever is going to enter that room what sort of precautions they have, will really help to disseminate the message to everyone. So those are an A+, and I really recommend those to use in the clinical setting. And then a couple more things here: involve participants and skilled members. So this is just pretty self-explanatory. You can't disseminate information without a knowledgeable source. So the more professionals we can involve in this, the more audience members it will reach. And then to seek to promote the most information possible. That is just, all information is good, and especially information, nothing should be overlooked, and the more the better. So designing, implementing, and evaluation of change. to design any sort of study, any sort of intervention, you need to make sure it's measurable. And so you can't be, working in a setting that is not applicable to your current clientele. So make sure it's measurable to your real world conditions. As I previously touched on, ensuring adequate involvement of stakeholders is very important for funding and getting it off the ground. And then also grouping those stakeholders together to form a collective to track the sort of interventions that work, what is currently working, what is currently not. Sometimes it may be hard for hospitals to communicate, so having a basis of knowledgeable people outside of those boundaries can really help to move forward any sort of project. Make sure your implementation techniques are consistent, so your data can be reproducible, and that's what I touched on there. So how to sustain any change. So sustain any change is particularly hard in the healthcare setting, unless it's a very, very good idea. So consistent education is necessary. So implementation into schools, into education of nursing. You can also have ICU nurses being trained in certain regards. I know that sometimes ICU nurses are not trained on certain equipment, and to kind of remedy this, we need to have skilled professionals, as I discussed 2 slides earlier, really involved in healthcare setting to hopefully teach them how to do it. Establishing review boards, this is the out of the hospital setting to review what works and what doesn't. And finally, how to sustain the change. You reward them for sustaining and implementing this change in their facilities. So rewards such as funding, publicity, anything that will help to get companies to do this. Then finally, evaluating that change. I put this OWL on here because people are always looking at you with intensity in the healthcare field. It's important to make sure that the change actually worked. So focus review groups is very important. Any study needs these. And then the most important thing, in my opinion, is what do people at the bedside think? So this is both nurses and patients. So how do they feel about the interventions? How do the nurses feel about actually intervening? And what can we do to increase the long-term stability of our project? So whether it goes down the avenue of being green friendly, or whether it goes down the avenue of being cost efficient, let's explore those and make sure we have those accounted for when implementing any sort of project. I think this is a dual slide, but just more dissemination. It's important just to get the information out there. It doesn't really matter how you do it, just get it out there and hopefully your voice can be heard. So conclusion, to sum it up, this was a really interesting project, something that I am passionate about going into the ICU after graduation, so I'm curious to see how this will actually be implemented when I start working in the ICU. So modern interventions, so if you can recall, my 2 kind of points of my topic were modern interventions and kind of traditional interventions. So modern interventions have been successful. Any new modern interventions, we make some every day, and especially concerning infection control and everything, there's always new methods to consider, and they've been very, very helpful. Also, traditional methods have their merit in place in our healthcare system. For instance, the article that I read concerning oral hygiene definitely puts some emphasis on how valuable that is in our society and how we should continue to always do it. Touching up here, important to consider the pros and cons of each prior to implementation. That's good for any sort of study. How much is it going to cost? How much time do I have to devote to this and such? It's very important to consider all of those. And as always, I'd like to end this with universal standards are paramount in any sort of healthcare environment. So washing hands, good teamwork, and just respect and responsibility, the golden rule, are going to trump any sort of modernized intervention that you will have. So always go with your gut. We're in school for a reason, and practice what you learned. Here's my references, and thanks so much for listening.